Hi, I am Dr. Kavita. Please do subscribe to my YouTube channel. Today I am going to tell you about a topic called how to manage and maintain liver health if you have diabetes and if you are a pre-diabetic. Managing liver health with diabetes focuses on preventing metabolic dysfunction associated steatotic liver disease, which is MASLD. I again do repeat, metabolic dysfunction associated steatotic liver disease, formerly NAFLD, through blood sugar control, lifestyle changes, and regular monitoring. So, we can manage our liver health if we have diabetes through blood sugar control, lifestyle changes, and regular monitoring. People with diabetes face higher risks due to insulin resistance, promoting liver fat buildup. In people with diabetes, there is increased insulin resistance, which also promotes the liver fat buildup, which leads to fatty liver. Blood sugar control. First thing is we have to have a good control of our blood sugars. Achieve tight glycemic management with medications, diet, and monitoring to reduce liver fat accumulation. Collaborate with healthcare providers on personalized plans, prioritizing GLP-1 receptor agonists or SGLT2 inhibitors that benefit both diabetes and liver function. Persistent high blood sugar damages the liver over time. So manage your blood sugars well. Achieve tight glycemic management. See what diet you are taking, whether it is low glycemic index or high glycemic index. Manage your carbohydrates intake with complex carbohydrates mostly. Take most of the protein in 3 meals, including 3 meals of the day, and see whether you are taking adequate protein, because too much of protein causes inflammation, and see whether you are having a digestive satiety with the proteins or not. See your gut health, manage your diet and your plate with foods including lots of vegetables, lots of greens, and complex carbohydrates, healthy fats, and avoid sugary drinks if possible most of the time, and monitor yourself to reduce the liver fat accumulation. Reduce the saturated fat intake so that you can prevent fatty liver in long term. Next, coming to dietary strategies, adopt a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats like avocados, nuts, olive oil, while limiting saturated fats, added sugars, refined carbs, and sweets. Spread carbohydrate intake evenly and choose low glycemic foods to stabilize blood sugar and minimize liver fat storage. Portion control supports these goals without extreme restriction. Don't restrict too much any kinds of foods. Limit the saturated fat intake, limit the added sugars, limit the refined carbs and sweets. Include avocados, nuts, olive oil, healthy fats into your diet. Include whole grains and lots of vegetables and fruits into your diet. Choose fruits with low glycemic index. Exercise recommendations. Engage in at least 150 minutes of moderate physical activity weekly, combining aerobic and resistance training to improve insulin sensitivity and reduce liver fat. So, how to include exercise into your schedule? If you are a busy person or if you are a non-motivating person, you can't do exercise daily. Choose 2 days of the week or at least 1 day of the week. Spend your time in gym or in a park, exercising yourself, stretching yourself, walking for a long run, or gently jog yourself. Make stretches of yoga and complete your exercise schedule at least with 150 minutes per week. So it can be a moderate physical activity weekly with 150 minutes standard. Include aerobic and resistance training also. Have a 1 kg or 2 kg dumbbell at home so that you can lift it whenever you want to. Include some of the gym apparatus at your home so that you can gym at your home itself. This all reduces liver fat and instead reduces fatty liver. Activities like walking, dancing, or weight training enhance blood sugar use and combat steatosis independently of weight loss. Start gradually if sedentary, and check whether you have a sedentary lifestyle. Do not have prolonged seating time. Wake up and do walk in between. Schedule your work and walking time also. And if you are not an exercising person, if you don't want to go for a walk, if you don't want to do weight training, just simply dance on your own song. Keep a song in your iPad or a phone or a mobile or a laptop and close the room door and dance yourself for half an hour. If you try this for 2 days in a week, that completes your exercise regimen sometimes. Weight and risk factor management. Aim for gradual weight loss if overweight, as even modest reductions improve liver function. Do not reduce the weight at a stretch. Reduce your weight gradually. You can do it with portion control, regular exercise, proper sleep routine, maintaining sleep hygiene and mood management, and correcting your hormonal imbalance. And there are a lot more to control your weight. Control blood pressure, LDL cholesterol and triglycerides through lifestyle and medications. Check your LDL, check your HDL, check your triglycerides. If you are deficient of HDL, take healthy fats in the form of nuts and seeds. If you are too high of your LDL, exercise, and you can do it with proper management with statins, which your healthcare professional will suggest you. Check your triglycerides. See the carbohydrate intake. See the oils that you are including in your diet. Strictly limit alcohol to 1 drink daily for women or 2 for men, or avoid it entirely. I say avoid it entirely because even a single drink of alcohol harms the body up to some extent, at least according to recent guidelines. And in the long term, it causes various organ damages, which is not beneficial to us. Monitoring and screening. Coming to monitoring and screening, screen annually with liver function tests and calculate FIB4 score every 2 to 3 years using age, platelets and blood enzymes to detect fibrosis risk. This will be done by your healthcare professional, and he'll check your liver function tests once yearly, and he'll assess your liver function, and he'll give you dietary and exercise regimens. Routine checkups enable early intervention for MASLD, especially in type 2 diabetes with obesity. If you are obese, try to lose weight. If you are diabetic, try to include low glycemic foods, and exercise should be a major option for you. And you can consult your nutritionist if you have a fatty liver to include diets which regulate your liver function and decrease the incidence of fatty liver from grade 1 fatty liver to grade 3 fatty liver. You can assess your progression from grade 1 fatty liver to grade 3 fatty liver sometimes with the help of an ultrasound. Simple ultrasound is enough. But once you have a grade 1 fatty liver, it's time you should check your liver function tests, your fibrosis 4 score, routine checkups for MASLD, and if you are obese, you have to go for weight loss, and if you are a diabetic, you should have an achievement of tight glycemic control. Discuss supplements like omega-3s or berberine only under medical guidance, as evidence varies. Do not take any supplements without the suggestion of healthcare professional. You can simply include omega-3 fatty acids in the form of nuts and seeds, and fish. Certain types of fish also include omega-3 fatty acids into your food. But be careful whether you are taking omega-3 fatty acids or omega-6 fatty acids. And if the composition of the food contains both omega-3 and omega-6, you should have again portion control, because omega-6 is not good for health and omega-3 is very good for health. Thank you. Please subscribe.